Hi, everyone. We will be getting started in just a couple minutes. Just as a reminder, and I also want to make sure you guys can hear me, so let me know in the chat if you can hear me. The chat should be either to your right-hand side of your screen or possibly underneath. And if you have any questions throughout our presentation today, you can always drop it in the chat and question and answers, and I will look through that as well. Hi, everyone. Just giving people a couple minutes to hop on. Again, if you're just joining, there should be a little chat screen on the right-hand side or underneath, and you're welcome to ask any questions in there, and I'll try to answer as many as I can. We'll get started in just another minute. All right, so I'm going to go ahead and get started. Today we're talking about cancer, so how to stay ahead of cancer and some prevention and screening tips. I am Dr. Wright. I am a naturopathic physician here at Desert Wellness Center, and I am licensed in the state of Arizona. I also completed a 2-year family practice residency at the medical school here, which is called Sonoran University. I work with a lot of different patients on different conditions. We do some primary care here, but focus definitely on hormonal imbalances, gut health, some autoimmune, mental health, inflammation, that kind of stuff. And we always try to address the root cause and help the body heal itself. Okay, so today we're talking about cancer. So things we'll talk about are cancer risk factors along with prevention techniques and lifestyle changes, key screenings to prioritize, and this can include mammograms, skin cancer checks, and a few others we'll talk about. The latest in early detection, Galleri, which is a new test that we have here at Desert Wellness Center, and it's a groundbreaking test that we will definitely talk more about later in the presentation, and then how to create your own personalized schedule for cancer screenings. Okay, so we'll start with some cancer statistics. So on the left-hand side is a little graph that you see, and it's basically showing the trends in cancer incidence. So it started in 1975, and then it's projected all the way up until 2040. And so basically it's showing that cancer rates are continuing to rise, unfortunately. And then the different colors look at the different age groups. So less than 50 is going to be that darker blue at the bottom. And then sort of as you increase in age, it increases as well. So some stats, a little over 2 million new cancer cases are expected to be diagnosed in the US in 2024. Approximately 1 in 2 people in the US will be diagnosed with cancer throughout their lifetime, and 1 in 5 risk dying from cancer. Cancer has been one of the top 2 leading causes of death in the United States for over 75 years. And something scary to think about is approximately 140 people every hour actually die from cancer-related deaths. And then excluding non-melanoma skin cancer, at least around 40% of newly diagnosed cancers are potentially avoidable with changes in lifestyle and environmental factors that are known to be associated with cancer incidence. And then men and women do have a little bit of different rates of cancer. So the stats show that there's higher incidence and death rates for men than women right now. So all of this is showing that, you know, a lot of people are affected by cancer, whether it's, you know, it might be you or someone that you know. And unfortunately, the rates are continuing to increase. I will say, though, the mortality rates are declining, which, you know, speaks to maybe early prevention tips or screening techniques that are catching it early, and then definitely treatment options. This is a little sort of pie chart graph, and it shows on the left side new cancer cases and the right is new cancer deaths. So this is basically showing that there are 5 types of cancer that are the, you know, make up 50% of the new incidence and death rates of cancer. And those are breast, prostate, lung, colon, and pancreas. And pancreas is more so just with death rates. And then, you know, on the other side, there's 50% of cancer that, you know, you don't really have good screening techniques and tools for yet. And so we'll talk more about that. These are looking at the most common types of cancer. So in men and women, they're a little bit different. Men, prostate is definitely the highest, and then lung cancer, followed by colon, bladder, and a few others there. And then in women, it's more so breast cancer, and then lung, colon, uterine, and so on. So, you know, breast and prostate are definitely the highest, followed by lung for both men and women. Okay, so some risk factors. The biggest risk factor is age. So adults over the age of 50 are 13 times more likely to have cancer compared to anyone under the age of 50. And the graph is just showing different age groups and the prevalence of cancer. So that really supports that age is the biggest factor there. But there are a lot of other risk factors that also play a role. Some of them, and you know, some of it is genetics can play a role, of course, but these are more so things that are lifestyle things or preventative things that could play a role as well. So diabetes and blood sugar dysregulation, obesity or increased body mass overall, low muscle mass and limited physical activity, smokers, tobacco smokers, either currently or previously, frequent and excessive alcohol use, poor diet, and this is, we'll go more into this later, but you know, high processed foods, sugars, those type of things can affect it more so than anything else. Chronic inflammation and elevated CRP, which is an inflammation marker that you can check in labs. Oxidative stress, which is an imbalance of something called free radicals and antioxidants in your body. And basically what this says is the more free radicals you have, the more cell damage that can happen. And it makes it harder for your body to repair those cells, which can then potentially lead to increased risk of cancer. Also something to note is there are some studies showing associations between higher levels of suppressed emotions and sort of stress with cancer-related incidence and mortality. All right, so alcohol I wanted to talk a little bit more about because I think alcohol has become such a just like a normalized aspect of our world. And there is definitely a time and place for alcohol. I'm not anti-alcohol by any means, but I think it's important to understand the potential consequences or negative effects long-term based on how much you may or may not be drinking. So research shows that the more alcohol a person drinks, and even more specifically, more alcohol someone drinks regularly over time, increases your risk of developing cancer. Even if you only have 1 drink per day, or if you're more of a binge drinker, and women, that would be 4 drinks on one occasion, or men, it would be 5 drinks on one occasion, those still show to increase your risk of cancer as well. Studies, and this is from 2009, so a while ago, so it may have even increased since then, but an estimated 3.5% of cancer deaths are solely just related to alcohol. The specific types of cancer, and it can really affect any type, but the most specific or most common ones that alcohol can increase the risk for are head and neck, esophageal, liver, breast cancer, and colorectal. And then more specific to breast cancer, one study found that a total alcohol intake of more than 27 drinks per week, which is about, on average, 3 to 4 drinks per day, increases the risk of breast cancer in premenopausal, so more of that perimenopausal, usually like early 40s, 50s, independently of the type of alcohol. And then for postmenopausal women, any type of alcohol more than 6 drinks per week actually increases the risk of breast cancer, which goes back to, at least 1 per day could still potentially increase it. So I think this is just important to know and be aware of. And then, it's always up to you and what works best in your lifestyle. But I think, unfortunately, alcohol is a poison to our body and can cause damage. And there's not a amount that is necessarily safe. And so, live your life, enjoy, of course, but also be aware of what could happen. Okay, so let's get into some cancer screening. So early cancer screenings have definitely been shown to diagnose potential cancers, diseases, and lower mortality rates, which is awesome. There's only a few current types of cancer screenings that are sort of well-known and used. And like we saw earlier, there's, those 5 main types of cancers, but 50% still makes up a good chunk of them that there aren't great screening tools currently for. So we'll go through those and then some other options as well. So for cervical screening for women, they recommend Pap smear with HPV screening. These are recommended to start at age 21 and end at 65. And this is if you have a cervix. So if you have had a hysterectomy where they remove your cervix, then sometimes that changes, and that's often determined by your gynecologist. And then this is also if you've had normal screening tests basically throughout your life. Generally, they recommend every 3 to 5 years if it's been normal. And then if you have a serious history of, precancerous cells in the cervix, they actually recommend continuing testing up to 25 years after that diagnosis. So that could change the age range a little bit. Prostate screening. So these are digital rectal exams and or PSA, which is a lab test. These are in the research recommended, but not as strongly. And this is something that you would sort of talk to your provider about and decide if it's a good option for you. I will say oftentimes, with things like hormone replacement therapy, it would be more important to get this as well. But that's something to, discuss with your provider. So they recommend starting at age 50 for men who are just average risk. If you're a little bit higher risk, so this could mean a first degree relative with prostate cancer earlier than 65, or for African American men, they are just at an increased risk. And so they recommend starting at age 45. And then if you're at an even higher risk, so more than one family member, then they recommend starting at 40 for these. These are generally every 1 to 2 years, and that's definitely based on results as well. Okay, for colorectal screening, so for colon cancer, they recommend colonoscopies. The standards and guidelines recently changed, so now they recommend starting at age 45 and all the way through 75. The frequency depends on your results. So they'll let you know once you do those and once you follow up with your provider, sort of what is recommended. But usually it's every 1, 3, 5, or 10 years. And then age 76 through 85, that's sort of a discussion with your provider as whether you should continue or not. There's also something called a Cologuard stool test. So this is a stool test that you would do at home, and then you send it back in. And although it's not standard of care at this time, it could be a really helpful tool or addition. Or, I mean, honestly, I have some patients who just don't want to do a colonoscopy at 45. They say, nope, I decline that. And this could be a great way to still have some type of screening. And if it is positive, then that would maybe give a reason to then go ahead and do the colonoscopy. But standard of care at this time is still the colonoscopy. And then if you're high risk for colon cancer, then they recommend starting sooner than 45. So this really depends on what you have going on, if it's a family history, if it's, different types of inflammatory bowel disease, stuff like that. So the biggest things are an immediate family history of colon cancer. If you have had something in the past, if you have ulcerative colitis or Crohn's, or like a hereditary known genetic mutation or something that increases your risk, or if you've had radiation in your sort of abdomen belly area to treat maybe a different type of cancer previously. This usually starts at age 35 or 8 to 10 years after whatever sort of condition or diagnosis has happened. They do recommend skin screenings. This is done usually by a dermatologist. They usually recommend yearly unless if everything's normal, and then they'll sort of tell you how frequently to follow up if there's anything concerning going on. There isn't an exact guideline for when to start, but general consensus is as early as in your 20s to 30s, just to screen for skin cancer. And then lung cancer screenings are generally a chest x-ray or a low-dose CT. And this really depends on if you're maybe a smoker or if you have in the past. So they recommend starting at age 50 to 80, or of course, if you have symptoms, maybe sooner. All right, and then I wanted to do a whole separate slide on breast cancer just because there can be a lot sort of surrounding it. So the breast cancer screening type that is recommended is a mammogram. Usually if it's just, you turn 40 and no symptoms or anything, it will just be called a screening mammogram. And that starts at age 40. And that usually is every 1 to 2 years, but it does depend on your age and findings. So if you're 40 to 55, they recommend generally yearly if it's normal. And then if you're over 55, every 1 to 2 years. If you do have an immediate family history of breast cancer or you're high risk, then usually they recommend starting the screening mammograms 5 years earlier than that family member was diagnosed, or at age 30, sort of whichever one comes first. And then high risk, so there's a few things that can sort of determine if you're high risk. The BRCA mutation, which is a genetic mutation, if you personally have that, or a first degree relative has that, that could increase your risk. If you have a strong family history of breast cancer or ovarian, and then if you've had chest radiation done, maybe for other reasons, that could potentially increase your risk. And like I said, usually they recommend starting those screening mammograms at around 30 then, and sometimes they'll also do alternate or add in an MRI just for a little bit more. I also wanted to note self-breast exams, although they're not diagnostic, they can be helpful. So if you know what your own tissue feels like, it can be really helpful because you can notice any changes or lumps or anything sooner, which then could get you in and making sure everything's good sooner. Okay, and then a couple of myths and misconceptions with breast cancer screenings. So one question I get a lot is a mammogram, is it worth it? So based on one study, women who got screening mammograms had statistically significant, about 40% reduction in their risk of dying of breast cancer within 10 years, and a 25% reduction in the rate of advanced breast cancers. So this means that it's catching it early, and rates of mortality are definitely decreased. So I would say yes, right? Anything that's gonna benefit you in the long run would be a positive. And then what about radiation with the mammogram, which I commonly get this question as well. On average, they found that with just a normal screening mammogram, the radiation amount is 0.4 MSV. And to just put it in perspective, you are exposed to about 3 MSV, just like in your yearly life with environment and all of those other things. So if it's increasing the chance of they might find it early and you have a lower risk overall, and it's not too much radiation, again, I think that it is definitely worth it. Something else that I commonly get asked about is thermograms. So thermography is a different type of sort of imaging technique that uses an infrared camera, and it detects heat emissions from the targeted body area, so from whichever area they're looking at. And the theory behind this is as there's increase in blood flow to a tumor, the temperature around the tumor should also increase, which then would change how the tissue looks with the infrared camera. They did do a study on this to compare it to mammograms. And although there are some similarities, the biggest thing to note is the sort of accuracy of it, as well as specificity, which were both lower. And so I think it can be a helpful tool, but I have heard of a few cases, unfortunately, where a woman did a thermogram instead of mammogram, and it didn't end up catching something that was there that a mammogram ended up catching later. And so again, I think it can be a tool, but still standard of care. And what is shown in the research is that mammogram is sort of the best option and the most helpful. Okay, and then a few other types of tests. So there is a newer type of test called the Galleri screening test, and we'll talk more about this on the next slide. Other things that are helpful screening tools are a complete blood count, which is looking at your red blood cells and white blood cells, your comprehensive metabolic panel. So this looks at your kidney function, liver function. CRP is that inflammation marker. PSA, that's the prostate marker, and for men. Sometimes, in specific cases, maybe tumor marker tests, genetic testing, especially if you have a family history, things like BRCA or other ones. And then there's another blood test called galactin-3, and this actually has been shown to be elevated or involved in cancer progression and metastasis. So that could also be a helpful tool. All right, so let's talk about the Galleri test. So the latest and greatest in cancer screening. Like I mentioned before, there's only about 5 screening tests that are sort of standard of care right now that they are able to do. So this could pick up a lot of other cancers potentially that are not able to be screened for early on right now. So it's a blood test, and it's a multi-cancer early detection blood test that screens for a lot of the deadliest cancers before they can even become symptomatic, so super early on. And it screens for more than 50 types of cancer. So super awesome that they have created this, and it can be such a great tool. It actually looks for cell-free DNA in your blood and determines if it is coming from a cancer or a healthy cell. And then if it is sort of shown to be from a cancer cell, which specific organ it's coming from. They recommend this for adults over 50, since that's sort of the highest risk, right, of developing cancer. And then if you are high risk at developing cancer for other reasons, then you could potentially do it. And then the Galleri test demonstrated high specificity, so it's really specific on finding specific cancers and where it's coming from, and a low false positive rate, which is really good. Peace of mind there, right? It has a 76% sensitivity for the 12 deadliest cancers, and that's what this chart is over here. So this is the type of cancer and how sensitive the Galleri test is at being able to detect it. And so a lot of these, liver, head and neck, esophagus, pancreas, ovary, a lot of those, they don't have other tests right now for early detection. So this is huge. And then, there's more, like I said, there's 50 types of cancers, but these are just the top few that it screens for. And they have found that when cancer is diagnosed early, before it has time to spread, the overall 5-year cancer survival rate is 4 times higher than if it's diagnosed late. So like I said, I think Galleri, this test, which we do have available at Desert Wellness Center now. So if you are potentially interested or think it might be helpful for you, give us a call and your provider can get that scheduled for you and ordered. But it's a great tool in addition to those other tests that we talked about. So the mammogram and, potentially a lung test if you need to, and PAPs. So it's a great addition to that type of stuff. And then I just wanted to throw in here, so I get asked this a lot as well. So cancer and hormones, so some myths and misconceptions. So a lot of people ask me, do hormones cause breast, uterine, or prostate cancer, or cancer in general? And I would say the short answer is no. So here's some actual research on it. Women with a uterus who take estrogen combined with progesterone, there is no shown increased risk of uterine or breast cancer. I will put a caveat on that with progestins, which is synthetic progesterone, does potentially show to increase the risk. So that's why it's important to work with a provider who is well-versed and specializes in hormones, so they know this literature and this research. Women who have had a prior hysterectomy and take estrogen replacement therapy, there's actually a decreased incidence of mortality of breast cancer. And then for women with a family history of breast cancer, hormone therapy does not actually further increase the risk of breast cancer than potentially they already were based on that. So overall evidence from different research and trials shows a significant reduction in both the incidence and mortality from breast cancer in women who took hormone replacement therapy. And testosterone is another hormone that we commonly talk about. And testosterone has shown to have breast protective effects in both pre and postmenopausal women. And actually with men as well, it's been shown to, it has not been shown to increase the risk of prostate cancer and may even be preventative as well. Okay, we are almost there. So how to reduce your risk of developing cancer. So a lot of this stuff is more lifestyle related. And like we talked about at the very beginning, up to 40% of cancers actually can be related to or decrease the risk with just lifestyle interventions. So, of course, avoiding tobacco, cigarettes or vaping or any form is going to decrease that risk of lung cancer, which is such a high prevalence. Maintaining a healthy weight and metabolic function. So that could include blood sugar levels, blood pressure, all of that. Limit your exposure to environmental toxins, which easier said than done. I mean, it's all over in our environment, but things that you can control. So chemicals that you might use in your household products, plastics, pesticides, things like that. There's actually a list on some of the cancer websites that talk about which chemicals and heavy metals are known carcinogens, so known to cause cancer. So if you're interested, that's definitely something that you could look into as well. And then with that, we're exposed to so many things. So just supporting detox pathways with having regular bowel movements, drinking enough water, saunas, that type of stuff is helpful. Diet is key. I mean, this is such a big player in cancer. So focusing on a whole foods diet, fruits, vegetables, whole grains, lean meats, avoiding or limiting, processed meat, processed foods, sugars, red meat even has an increased risk. So diet, I would say, is one of the biggest players here. Make sure you're eating organic, local or non-GMO whenever you're able to. And then we talked about this, but limiting alcohol use. And I still think that this might be too much, but in the research, they say no more than 1 drink a day for women and 2 for men. Okay, and then physical activity. So they recommend at least 75 to 150 minutes of vigorous activity or 150 to 300 of moderate per week. Strength training also shows to increase muscle mass, which decreases the risk of cancer as well as mortality rates. Definitely protecting your skin from the sun, avoiding tanning beds, always use sunscreen or cover up with hats, preferably sunscreen that's more mineral-based, less chemicals for you. Reducing overall inflammation and oxidative stress. This could be lifestyle, supplements, things like that you can work with your provider on. Managing stress and supporting your mental health. And then, it's important to get your regular screening exams, your checkups, and then know your history, know yourself, know your family history and your risks overall. So you can come up with a personalized plan for you to decrease your risk of cancer. Alrighty, so these are all my sources. That's what I have for you guys today. Any questions? Let me look. I think I have a couple in here. Question is, I'm curious what types of cancers are common when chronic inflammation is the cause. So I would say it's just like a general. So inflammation, I would say, is one of the root causes of cancer. So it could be any of them, honestly. And it's also, everyone is potentially predisposed to different types of cancers dependent on, your lifestyle and your family history. So certain ones might come out more specifically for you. But inflammation definitely is like at the root of a lot of cancers in general. Any other questions I can answer? Well, there's a ton to know about cancer prevention. So this really just touched the surface. So if you guys have questions or, want to schedule an appointment or talk to someone about what might be, your next steps with prevention and maybe screening tests, or you have questions on the Galleri test, any of that, give us a call. But I hope this was informative and gave you guys a little bit more information and a resource. So yeah, give us a call if you have any questions. And thank you so much for joining me today. And I will hopefully see you guys around soon.